Hello, we are Team Baker, and we are presenting on the costs of asthma in Rice County over a 3-year period from 2009 to 2011. Through our dual stakeholder analysis, we conclude that Rice County Hospital's in-kind donations to Health Finders Collaborative are effective in preventing emergency department visits, which is a mutual benefit for both stakeholders. We use green to indicate assumptions and blue to indicate linked data in our spreadsheet. We start by identifying two key stakeholders. The first are Rice County hospitals. The hospitals give in-kind donations to Health Finders Collaborative to reduce uncompensated asthma care costs and to promote effective asthma management. Our second stakeholder is Health Finders Collaborative, which is a nonprofit health management organization serving the Rice County area. Beginning with the hospitals, we want to estimate the costs of uncompensated asthma care that accrue to the hospitals. Using data from the Minnesota Department of Health, we found that there are 605 asthma emergency department visits in Rice County from 2009 to 2011. Next, we found data from the Minnesota Department of Health showing that the percent uninsured in Minnesota as a whole is 10.4%. This is a conservative estimate because the percent uninsured is most likely higher among Health Finders patients than in the state of Minnesota as a whole. We multiply these two pieces of information together to arrive at the total uninsured asthma visits in Rice County to be 63.
We proceeded by finding the average cost of an asthma ED visit from a 2007 Minnesota Department of Health study. We multiplied this value by the total uninsured asthma visits in Rice County to estimate the total cost of uncompensated asthma care incurred by Rice County hospitals. Now, we want to find the hospital's return on in-kind donations by comparing the total cost of uncompensated care to the hospital's savings. To find the hospital's savings, we needed to find data on how asthma management interventions for low-income individuals affect asthma ED visits. According to a 2006 study from Peter Hoke in Journal of Asthma, the provision of free or reduced cost inhalers to low-income individuals decreased the number of ED visits for asthma by 62.5%. The study took place over a 5-year time span in Virginia at the Johnson Health Center. We choose to cite the study because we find that the Johnson Health Center's mission is very comparable to Health Finders Collaboratives. However, we believe that the 62.5% reduction in ED visits is perhaps inflated, so we decided to use conservative percent reductions as well. Therefore, 62.5% became our upper bound and 10% was our lower bound. Quickly note that the hospital ROI is 0 for the 10% scenario. This was an intentional decision of our group, shown by the orange columns, meant to show the break-even point in our analysis based on the assumption on the percent of total expenditures used on healthcare. For example, if ED visits fall by 10% and HFC uses 40% of its in-kind donations for patient services instead of administrative costs, the hospital will break even on its asthma-related in-kind donations. We believe this number is very obtainable given the Hoke study.
We calculated the ROI by comparing the hospital's total in-kind donations used for asthma management with estimated hospital savings. Later in the video, we will explain how we obtained our in-kind donation numbers used for asthma management. As you can see from the ROIs, the in-kind donations to HFC for asthma management are effective reducers for uncompensated care. Our second stakeholder is Health Finders Collaborative. We want to determine the number of ED visits HFC prevents, which coincides with the Collaborative's mission statement. We found information about the number of patients HFC sees during a 3-year period, which is 3,154. We proceed by calling a nurse practitioner at HFC to approximate the percentage of patients at HFC with asthma, which she estimates to be around 10 to 15%, which we ended up using 12.5%, or in our Excel sheet, 13%. We multiplied this estimate by the total number of patients at HFC to obtain the number of patients at HFC with asthma. Next, we acquired the HFC expenditures from a 2009-2011 in an annual report. We multiplied this number by 35%, which is the percent of expenditures from in-kind donations that HFC received in 2013. We then made an assumption about the percent of total expenditure devoted to patient care instead of administrative care. We multiplied the percent of HFC patients with asthma, 12.5%, by the 3-year expenditure figure and then multiplied that by our assumption about the percent of expenditure devoted to patient care instead of administrative costs. The result is total HFC expenditure on asthma management, which we divided by the number of asthma patients at HFC to obtain expenditure per asthma patient. The purpose of this exercise is to provide an estimate to hospitals about HFC's per asthma management expenditure per patient. The key of this stakeholder analysis is the last row, which shows the number of ED visits prevented by HFC's asthma management programs. Is obtained by multiplying the percent decrease in ED visits from asthma given by the Hauk study by the total number of asthma patients at HFC. Our data presented from this analysis spans from 2009 to 2011, a 3-year duration. For conveniency, we also calculated the same analysis on an annual basis, which can be seen on sheet 2. The purpose of our study, again, is to prove that in-kind donations from Rice County hospitals are a cost-effective measure in reducing uncompensated care. Given the return on investments and also the number of ED visits prevented, it's clear that the in-kind donations are effective. Thanks.